the recording, those of you who are just joining us are saying some really brilliant stuff. Anyway, when we are finding those unique and specific ways that someone feels safe, connected, and in control in our presence, we need also to remember that if you are someone whose brain has felt, pretty safe and pretty in control most of the time, most of your life, that might be pretty quick. A few reassuring words or a hug might be enough to do the trick and start helping us back into our window of tolerance. If you are someone who, as we said several slides back, spends most of their waking hours and maybe even a fair amount of their sleep time in that state of hyperarousal, that fight, flight, freeze, fawn, or in a state of being shut down and disconnected, it's going to take a minute, right? And we need to be really patient with people. But what I have seen is that the more people learn, and remember, learn equals brain change. That's really what it is. The more people learn that they are safe and connected in our presence, that we will help them to regain a sense of control of themselves, that we will help them to be grounded in the present again, then the more powerful that becomes every time we do it. And so ideally, just like we saw people's window of tolerance get narrower and narrower and narrower with that repetition of trauma or triggering and stress, we can also see it start to widen. And people don't become as triggered as easily as they did before. And they do regulate, or I should say re-regulate, a little more quickly each time. It takes a long, long time. People often will ask me when I do this training, well, how long does it take for someone's brain to change when they've experienced traumatic stress? How many times do we need to do this with them? And I always say, much longer and many more times than you want it to be. So keep in mind, some of the folks we work with have experienced trauma and the after effects of trauma for decades. That's a lot of stress on the brain. That's a lot of brain change. It may take a very long time. And even then, does someone's brain, when they've experienced trauma, especially remember that sort of dark trifecta of early, severe, and chronic? When someone's experienced that kind of damage, especially early in life, or repeatedly, or at high levels of terror, does their brain ever get back to like factory settings where everything's just like it was before the trauma? Probably not, to be honest with you. For some folks, trauma may be something they grapple with every day in some way. But I've also learned, and I am not an idealist. I'm a realist when it comes to working with trauma. I've done this for a very long time now. And so what I can say confidently, with no exaggeration, is that I do not believe, and I never have experienced a limit to the potential for human healing and growth. I don't think there is one. I think for every individual, they get here, they get there, they get to this other place along the road. But I don't think anyone has ever been able to tell us some number, or to cap that. And I think that's true for us as well. I know that for many of us in the audience today, trauma is something that we know intimately as well. And so maybe that's helpful for you to hear today also. There is no limit to the amount that human beings can heal and learn and grow and change. So we're now going to get very practical for the rest of our time together. It's all been practical, but now I think we're going to talk less about ideas and more about techniques, which hopefully will be helpful to you. It's always been very important to me as a trainer, as a teacher, as a lecturer at Ohio State, in all of those settings. It's always been very, very important to me that you walk away with something that you can use right away. Trauma can be something you can spend the rest of your life learning about. But I also think it's helpful if you feel like you've got something useful when you leave the training today that you didn't have yesterday. And that's really how we're going to spend the rest of our time. But the next thing I want to say is this. And this blends nicely into what Kevin will be talking about and what he talks about in his book, in terms of how do you get an entire organization behind trauma responsive care? How do you equip everyone that way for all the things that I mentioned, for leadership, working with managers, for managers and supervisors supporting their staff, not just staff supporting individuals. But there are three principles that are really at the heart of a trauma responsive care, or an agency that is trauma. Nope. Let me start again. Any agency that is trauma responsive. Any agency that has made trauma responsive care the heart of what it does has these three things happening. The first one is that trauma responsive care is relationally based. It is based on relationships. And that means taking the time to get to know someone and understand them is really critical. This isn't something where you can just cut and paste with anybody who walks through the door. The other thing is that it's universal precautions. So we're going to talk about that just really quickly. Everyone in this audience, probably many times, if you've been in your career for a while, has had to go through first aid and CPR training, right? It's standard for a reason, because you never know when you're going to need it, and everybody needs to be trained in that and needs periodic, brushing up with it. Well, what we learned in first aid was universal precautions, right? So let's say I'm an individual that you work with, and I get a cut and it's bleeding, right? I don't need an EMT. It's not like raw, but it's bleeding. What do? Do you just grab a Kleenex out of the back of your pocket? I'm like, right? No, because that's disgusting. But you put on gloves and you give me a Band-Aid or whatever. And then if there's blood or something afterwards that, got on stuff, then you clean it up with a bleach solution or a sterile solution. Why do you do that? You do that because I might be sick, and I might be sick in a way that can make you sick. If you've got a tiny little scrape or cut or hangnail that you're not even aware of, and some of your blood or my blood gets in that little nick or cut, I could give you hepatitis or HIV or who knows what. And you can't tell if I'm sick just by looking at me. I might not know I'm sick. And you don't have time to test my blood and run it to a lab and then, come back in 2 weeks to give me my Paw Patrol Band-Aid. Like, that's not practical. You can't give me a 6-week course of antiviral injections just in case I have hepatitis. Like, that's not safe and potentially harmful to me. So what do? It's incredibly simple. It's so simple that it's easy to miss how brilliant it really is. What you do when you put those gloves on before you clean up my cut and give me that Band-Aid is you treat me as if I'm sick. You make a bet, essentially, okay? And you behave as if you know that I am sick in a way that I can communicate it to you. Now, what happens if, as is the case most of the time, you're wrong? I didn't actually have hepatitis or HIV or whatever. What has it cost you? Meh, fractions of a penny. I don't know how much one pair of latex gloves cost. Like nothing. A little bit of bleach and some water. Nothing. So you bet in a way that if you're wrong, it doesn't cost you. What if you bet the other way? What if you look at me and you go, Laura looks all right. She's probably fine. And you don't put those gloves on and you don't use that sterile solution, and you do get some of my blood on that little cut and you become sick. What has that cost you? Maybe your life, right? And so the smart money says, bet as if she's sick. It is not intrusive. It is not harmful to me. It costs almost nothing, versus betting the other way where it could cost quite literally everything, right? Brilliant. And so simple. So we think about trauma responsive care as the emotional equivalent of that universal precaution, all right? And this is actually something that's been pretty standard in the kid world for a long time. We just applied it to developmental disabilities as well. It simply says this: trauma is so widespread in our population of the folks we support. And remember last time when I said that when you put together big T trauma, those huge life-altering events, and that little T trauma of, for some people, daily experiences of feeling invalidated or devalued or disempowered or ignored or overwhelmed or whatever, and you put all those together, boop, 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 that's more than 90%. More than 90%. If you were in a room of 100 people, more than 90 of them, there would be like 4 or 5 people that didn't have trauma. So you might as well treat it as everybody. And when you use trauma responsive care as a universal precaution, all you're doing is saying, just like I said before the break, you assume, if you're working with me, that you need to help me to feel safe connected and in control before you ask me to do anything else. Certainly, if I appear to be out of my window of tolerance, if I appear to be activated or shut down, then you're definitely going to want to do that. But really, it should be just standard operating procedure when we start our therapy session or start our social learning thing or go to our group activity or whatever it is. You want me to feel safe, connected, and in control. Right? So it's a universal precaution. And organization-wide, I've already touched on, I'll just say this, that it's very hard for a manager to be unsupportive of a staff person or for an executive to scream at an administrator and then expect that person to go help other people to feel safe, connected, and in control. We need to treat people the way we want to be treated, and we need to treat people the way we want them to treat other people. So it makes sense for the entire organization to try to help everybody from the lunch lady to the CEO lady to feel safe, connected, and in control in whatever way we can contribute to that. Okay, so oh, I'd love to talk about this. Okay, I'm just going to say this really quickly. Another thing from the great Bruce Perry is he points out that, remember that narrowing window of tolerance I pointed out, that the more time your brain spends in those states of being hyper aroused or hypo aroused, the more easily your brain goes there and eventually kind of stays there a lot. That also starts to govern how people experience you. And so he says, he's good at these little rhyming things, the state becomes a trait. The brain state that we're meant to only be in very briefly. We're only meant to be in fight or flight for a few seconds to get away from an angry goose or something. We're not meant to live there. And when we do spend a lot of time there, it starts to become our personality. It starts to become certainly how other people treat us. So we can become pretty rigid and inflexible. We try to control other people. We shut down really easily. We're irritable, all of that stuff. And it's how people see us. And it also leads to how trauma gets misdiagnosed as other things. Again, this is not a highly clinical training, so I'm not going to spend a ton of time on this. But remember last week when I said, you might be the advocate who says, hey, can we take another look at this person? And when you see some of these diagnoses, all right, and obviously somebody can have one of these diagnoses and not have trauma. Obviously, someone could have one of these diagnoses and also have trauma, okay? I'm not giving you a simple one-size-fits-all answer, but I will say, when you see somebody, and right now we are seeing a tremendous number of diagnoses of ADHD, bipolar, borderline. I've already talked about how I think oppositional defiant is a dumb disorder. It doesn't describe anything terribly helpfully. Same with some of these other ones, whatever. Even people on the autism spectrum. There can be overlap. There can be more than one thing happening, but there can also be that state becomes a trait, that what we're actually seeing is trauma that is hardened into kind of how they are all the time. And so for me, if you are either someone who is doing diagnosing or assessment, or you are probably more likely advocating for that, we should be having those conversations of how did you rule out trauma? How do we know that it's trauma that it's bipolar that we're seeing and not someone who's moving in and out of dysregulation? And a good sensitive clinician should be able to engage with that conversation. And it's hard to do, and it sometimes takes a while. So a good clinician will also be willing to go back and change their mind. So anyway, those of you who are in a position to advocate, if you think, wow, it would be really cool if we could spend a little more time looking at this, you might be that individual's best chance to be diagnosed correctly and supported and treated correctly. All right, so this last thing, I want to do so much more stuff, but we're going to spend the rest of our time talking about these skills that I mentioned. And this one, as I said before, is for us. Believe me, if I had some magic formula to get everybody instantly regulated, all the folks on your workload, all the folks on your caseload, all the folks on your staff, if I had some magic spell to do that, I would tell you what it was, but only after charging Dungarvin so much money, you all. So much money, okay? I don't have that, unfortunately, but I do have a set of skills and steps based in brain science. Some of it is developed out of the work of Daniel Siegel. So if you're a fan of his stuff and he's great, you might recognize some of the elements that we sort of grew this out of. It's a protocol for us. not for the individual. Our job is to work with us. When we are feeling at least somewhat safe, connected, and in control ourselves, when we are regulated, when we are in our window of tolerance, that's when we can be available to perceiving what it is that individual needs to feel safe, connected, and in control. If we're shut down or agitated or freaking out or furious, we just can't do that. We cannot respond effectively. So this is the calmer skills, all right? And starting with the letter C, we just check in. What is going on with me right now? Notice the order of those words. It should remind you of that slide where I took you through that handout that I sometimes use with my clients. Sensations, feelings, and thoughts. Because remember, bottom up, guys, right? From the body to the brain, not the other way around. What am I feeling in my body? And as I said, for me, if I feel my cheeks burning, if my eyes get teary, I don't know if any of you guys do this, but when I get very angry, I can also get tearful or cry, and that makes me crazy because people think I'm sad, and I'm not. I'm mad. But whatever it is, whether my eyes are welling up or my cheeks are burning or my voice is shaking, I've learned those are the sensations that let me know that I'm feeling angry or upset. What are the emotions I'm having? I feel powerless. I feel hurt. I feel scared. I feel shamed, whatever it is. What are my thoughts? Okay. So what is happening right now? And then the next thing, which happens almost exactly at the same moment, but they're a little bit different. Whatever the answer is, I have to accept that answer. Okay. Whatever I'm feeling, whatever I'm thinking is okay. It may not be okay to act on it, right? There are some things that are definitely not okay to act on, but that's not the same thing. That's not what we're talking about. And we tend to judge ourselves very, very critically, especially when we're trying our best, when we're trying very hard, when our job really matters to us, and we're trying to be helpful or we're trying to be successful. And if we feel like somehow we're not handling it right, we shouldn't be affected by this. As a veteran therapist, I know that it is very easy to tell myself, I shouldn't be affected by this. This shouldn't get to me. Blah, 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 blah. Well, that's BS. I'm sorry, but it is. I'm a human. I can have a bad day. I can have something that triggers my history. Something can hurt my feelings. I'm a person. And so if I can accept whatever is happening and really pay attention to that critical negative voice, I don't know about you, but my critical voice can be really cruel. And so if I can say to myself, hey, whatever I'm feeling or sensing or thinking right now, it's okay, right? It has its own validity. It may not be ultimate reality, okay? So, for example, when I started working with teenagers and that scenario that I described where they would just go off, until I learned and got more training and more experience and more guidance from the people that I worked with, of course I took that personally. And then when I learned more about teenagers and human beings and how they work and what was actually going on and that it wasn't really about me, then I could feel differently about it. That's great. So whatever I'm sensing, feeling, and thinking might change with more information. That's great. But in the moment, whatever I'm sensing, feeling, and thinking is okay. And that takes us right to the next step. Again, these first three can happen boom, 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 really quickly together. The next thing is try to be nice to myself, just like I would with someone that I was working with. If an individual is having a tough time and I want them to feel safe, connected, and in control, I'm going to be kind to them. I'm not going to be yelling or screaming or critical or mean. And that's, by the way, not the same as having consequences, right? That's separate. But simply, I'm going to try to be nice to that person, understanding, compassionate. Um, try to hold some space for them that they're struggling. Well, I can do the same thing for myself. I can say to myself, oh, I checked in. I noticed that I'm sensing, feeling, and thinking that I'm overwhelmed or angry or defensive or frustrated or whatever. And that's okay. Those are okay things to think and feel and sense. That's all right. I again may not want to act on them or make decisions based on them, but that is an okay thing to experience. I'm a human being. And I might just say something nice to myself, or I might do something nice for myself. For me, going outside and getting a breath of fresh air is often helpful. Um, Drinking a glass of water. And another thing I'll share with you guys is that I tend towards low blood sugar, and I have to eat. If I don't eat pretty regularly, then my blood sugar drops, and I can get really irritable and really crabby, and it's not great, right? Now, I know this about myself. I've been like this my whole life, so I've got a choice, right? Going back over all of these things, I can be really mad at myself. I can say, "What the hell's wrong with you, Laura? You know you need to eat. Why didn't you bring a snack?" Blah, blah, blah. I can be super, super mean and critical. Or I can just, you know, eat something. And that's probably going to make me feel better. So whether it's saying something kind to ourselves or doing something that supports our body, getting a little drink of water, stepping outside for some air, eating a little snack, or maybe we go to someone else for that. I know in the years and years and years that I worked in agencies, having my people around where I could step into someone's office and go, "Oh my God, this thing just happened," and know that they were going to be supportive, that they were going to be like, "Go get him, Tiger." No one actually said that to me because nobody says that, but you know what I mean. That really helped. It doesn't take much, right? If you really think about it, usually we don't need someone with a magic wand who makes everything okay. Maybe it's just that moment of encouragement or support. And then we're like, "All right, I'm going back in." Like, it usually doesn't take much. And if you have someone around who can do that with you and for you, great. But a lot of you guys don't. You're a foster parent at home with your kid, or you're a direct service professional alone on a shift. So you may be the person who has to do it for yourself. All right. Now, all three of these first skills are largely internal. Now we're going to switch our focus outward. All right. So, M, we're going to talk about being mindful. And mindful is a big word right now. We're using it a lot for a lot of different things, which is great. But in this case, I mean it in a really, really simple way. Mindful means, we've sort of been focusing inward. What am I feeling? What am I thinking? How can I be nice to myself? Now we're going to turn our gaze out. What is going on around me? What is going on? And we ask ourselves, what is happening right now? And even more importantly, and some of you guys who've been around the block a few times are going to know exactly what I mean. It's equally, if not more important, to ask, what is not happening? If you have been a staff person or some other role, and you've watched a situation spin out of control, it's with an individual and a staff person, or maybe it's between two staff, or it's whatever. um you know exactly what I'm talking about, where one person's having a hard time. Let's say it's the individual, and they are, they're not doing great, and then someone steps in and they try to be very controlling, or they get really like, "You need to blah, blah, blah," and they're just like, and they're really harsh and rigid. How's that situation going to go? Is it going to get better? Nope. It's probably going to just spin up into the atmosphere, right? It's going to boom. And if you ask people afterwards, you're talking to that parent in a family session, or you're talking to that staff person, why did you do that? Not in an accusing way, but just like, "Tell me what you were thinking." They'll often say, "Well, I was afraid that dot, dot, dot was going to happen." Okay. In other words, they were reacting to something that wasn't actually happening yet. Now, maybe it was going to happen, but maybe it wasn't. And I talk about this in my book. Where I saw this play out so dramatically was during a time that I worked at a runaway shelter. It was a crisis shelter. And we unfortunately sometimes had to call the police because a parent would show up drunk, and trying to take their kid, and it wasn't safe, or, kids were fighting and we couldn't safely break it up, whatever it was. And we were fortunate that most of the time, most of the law enforcement in the neighborhood knew us, and they kind of knew what we were about, and they usually were pretty cool. But it seemed to be sort of two extremes. We would get officers that came in, and they were kind of low key, and they were kind of slow, and they just, they would kind of separate people, and they would let everybody kind of have their say. And I learned very early on that when officers came in a little bit cooler, chances are things were going to work out okay. When they didn't, and it was usually one or the other, and they were I would describe it as like coming in hot. They were very loud, they were very and they were really aggressive. Somebody was going in cuffs. I knew that immediately from the instant they hit the door, because that doesn't de-escalate things, that only escalates. Now, that is not a critique or an analysis of law enforcement, which is a very problematic and complicated issue in our society right now. I'm simply saying how we engage in the interaction often has a big effect on the outcome. So to put this in an example that we might actually encounter, let's imagine that Kevin, my business partner, is a runner, or he elopes, which I think is a delightful DD term. I just love it. So Kevin, when he gets agitated, when he gets upset, he tends to take off. And of course, that's not good. It could be dangerous. We don't want him to do that. And so I'm working with somebody, I'm going to say Allison. I probably have an Allison in the group somewhere. If I have an Allison, just like, I don't know, give me a little shout out. I want to know if I actually picked one. So I'm working with Allison. We see that Kevin is pacing and kind of muttering, and we're like, oh, this is what he does right before he takes off. And I say to Allison, hey, why don't you go stand by the door just in case if he heads out, we can try to catch him. Is that a reasonable precaution to take? Sure. That's just being proactive and thoughtful. Is it reasonable in that same situation for me to leap across the room and tackle Kevin? No, right? That's way too much. And that may sound like an absurd example, but when you look at situations that kind of blew up out of control, not always, but often you will see somebody reacting to what they thought was going to happen or what they were afraid was going to happen, not what actually was. I don't want to tackle Kevin until he's actually running, you guys. Okay. Also, he's a pretty tall dude. I don't really want to tackle him. Although I probably could if I needed to. So I'm really short, so I could just go in at the knees. Next thing is express, right? I think it's better to try to be relatively, and again, it doesn't have to be perfect, but relatively regulated and having gone through these steps before we start giving a lot of directions or feedback, right? It's kind of like that rule when you write an angry email to somebody, maybe wait a couple days before you send it. Like give yourself a chance to regulate and reflect before you communicate. Now, sometimes if you're in a situation where things are happening very quickly, you're not going to have 3 days to think about what you're going to say. But I do think that if you go through these steps of checking in with yourself, reassuring yourself that you're okay, looking at what's actually happening, looking at what's not happening, and then here's what we need to do, or here's how I'm going to direct people or whatever, it's just going to go better. And certainly if you're going to bring a concern to admin or something, it makes sense if you've given yourself time to process a little bit. And then finally responding. And as I said, if you're in the middle of a situation, this might be boop, boop, boop. This could all happen within a few seconds. Or this might be something that you take time with, right? I'm not going to make a decision. This happened to me as a supervisor. There was some infraction or there was some problem. I tended to make better decisions when I gave myself a minute, So now I can take a step to do something or change something or address something. And again, this might be something that happens very fast, or it could be something that you give yourself some time to work with. And I would add that express can also happen afterwards as well. We do a whole training, and I can't remember if we're doing this with you guys or not. Kevin can jump on and tell me. But we do a whole training about self-care and burnout, and that has never been more important than during and after the pandemic and sort of the aftermath of that. And one of the things that I talk about is how toxic it becomes for the helpers when we don't have a place to unload our things. And so I want to say this really directly to you guys, okay? If you're sort of zoned out or multitasking, this might be a moment to tune back in. We, the helpers, have to have a place where we can let that stuff out. It could be with our coworkers, and hopefully it's positive and constructive and not just venting. Venting is helpful, but if it's all that's happening, it can actually make things feel more powerless and worse. But maybe it's our coworkers, maybe it's a supportive supervisor, maybe it's our partner or a friend, maybe it's someone that plays a role in your life, like a clergy person or a therapist, whatever that is. Even if it's you, even if it's just journaling, We cannot carry the stress and the pain that we absorb from helping people who are often in a lot of pain all by ourselves forever. We can't. And when I say it like that, I know it sounds very like, well, of course, but really a lot of us do it anyway, or we try. And especially those of us who play multiple roles. And I don't want to exclude men from that because men certainly can be in that position, but definitely for those of us in the group who are women, we often are being the mom, being the daughter, being the staff person, being the supervisor, being the foster parent, being the friend, being the one everybody always turns to, the glue, the support, the bedrock, whatever. And that's great. But you can't pour into a cup forever. Sooner or later, it's going to overflow, no matter how big the cup is. And if we don't have a place to release that stuff, eventually it will hurt us. And without making this a training about burnout and compassion fatigue and all of that, that's one of the active ingredients, y'all. That's how it works. So when I say express, that might be talking about it in the moment, as it says in that part of the slide, or it might be afterwards. It might be both. If you are kind of feeling this, if you're resonating to what I'm saying, if there's a little part of you going, oh, that's me a little, I encourage you to take that with you when this training is over. I hope you take a lot of this stuff with you. But really take that, make a note of it. Don't forget about it. Take the steps you need to take, even if they're just the little beginning baby steps of finding that place or finding that person where it's safe for you to let your stuff out. Just like human beings are not meant to live all the time in the red zone or the blue zone, we're not meant to live carrying all of that stuff from other people either. And I say that after all of my adult life being spent doing this work. So, in order to do these things, it is hard when we are really noisy in our own heads because everything's falling apart. Everybody's going crazy. There's, nutty stuff happening. Sometimes we're going very fast too. And so I want to add something to the calmer skills. It's just a little skill, a little strategy. I taught it to my staff. I like to teach it to audiences. There are lots of versions of this. I'm going to teach you one version of it. Okay. If you've got something that works in a similar way that you like, great. If you've never done anything like this before, I encourage you to try this and practice it. Because again, like we keep learning for good and for bad, the brain changes with practice, with repetition. And if you want this to be effective, the more you practice it, the more effective it is. So this is called the relaxation response, and I'm inviting you to join in with this. Of course, you do not have to, right? So if you choose not to, all good. But if you'd like to join me in this, we'll take just a few minutes here to do this this little tip of mine, and then we'll wrap it up and have some time for questions as well. So if you're going to do this, then I'm going to have you start by just sort of putting away anything that's super distracting. So if you've been on your phone, maybe put your phone aside. If you're looking at a computer screen or something, you can just sort of drop your gaze. I'm looking at like my tabletop, pretty boring. If you are comfortable putting your feet flat on the floor, go ahead and do that. I'm a petite American, so my feet don't touch. So if that's uncomfortable, don't do that. If you can, you want to be sitting up kind of straight, but in a relaxed way. So you might want, sort of fidget around a little, get comfortable. If you need support behind you, that's fine. So you're not like tightening your core or anything. This is not an effort, but you do want to be sort of like letting the air come in and out of your body. So if you're really slumpy, slouchy, you might want to sit up a little bit, as long as it feels comfortable and okay. Obviously, don't do anything that feels uncomfortable or painful. And there shouldn't be anything in this exercise that does, but so all we're going to do is breathe. That's it, okay? And we're not going to breathe in any special fancy way. You're just going to breathe. Some people like it if they breathe in through their nose and breathe out through their mouth, but if that's uncomfortable for you, you don't have to do that. What we will be doing is when you breathe in, you're going to say something to yourself in your head, okay? And what you're going to say is a little line or a fragment from your favorite prayer or poem or song lyric that means something to you. Okay, so the first thing is it needs to be meaningful. I'll give you an example. If your favorite prayer is the Lord's Prayer, you might say, "Our Father who art in heaven." You're going to say it in your head to yourself silently. Okay, or Allah Akbar or Shema Yisrael or Let It Be. It doesn't matter. It could be Yabba Dabba Do if that's deeply meaningful to you, but it should be something that is calming or peaceful or meaningful. Okay, that's the first part of it. The second part is it should be short enough that if you were saying it out loud, you could say it in one out breath. So I can say, Our Father who art in heaven, pretty comfortably. I could not say the whole Lord's Prayer in one out breath, you guys. I would be face down on the table. I'd pass out. So make it a small fragment. Now, I know that I have a lot of very driven, successful people in the group, and some of you are probably having right now what I like to call phrase anxiety. Is this the perfect phrase for me? Is there another phrase that's more meaningful to me? So let me relieve that for you guys and just say, if you like this technique and you practice it, you're allowed to change the phrase. It's okay if you think of something you like better. But for right now, just pick something. And what we're going to do is when I tell you to begin, and I'll have my little timer going on my phone, we'll do this for about, I'm going to say 75 seconds or so. Then we are maybe 90 seconds. Then I'm just going to have you breathe and say this phrase to yourself on your in breath, or sorry, on your out breath only. In breath, you're just breathing. Out breath, you're saying this phrase to yourself. Now, some people like to close their eyes. Some people don't feel safe closing their eyes. Close your eyes if you want to. If you don't, just have your gaze resting on something like your tabletop or something. So something that's not pulling your attention. As we're doing this, you're also going to get distracted. You're going to have a thought. You're going to have a feeling. I don't know. It's how our brains work. It is not a bad thing. It is, what do they say? It's a feature, not a bug. It's okay. All you need to do is notice that you've been distracted and bring your attention back to your phrase and your breath. That's it. Okay. So we'll go ahead and begin. Okay, we'll go ahead and stop it there. So just take a second, and for the last time, I'm going to ask you to think about bottom up, from your feet up to your head. Notice what you're sensing in your body, what you're feeling, and what you're thinking. What many of you will notice after doing this is that things might feel a little bit slower or a little bit calmer or a little bit more relaxed. Sometimes when we let ourselves slow down, people will say, "Oh, I notice how tired I am," or "how worried I am," or whatever it is. But doing this does a couple of things. The doctor who discovered this and taught his patients this technique was really trying to address physical illness, things like heart disease and high blood pressure. And what he found was that when his patients did this and when they practiced, he would have them practice, usually starting at about 2 minutes at a time, building up to maybe 10 minutes twice a day, that they started to have lasting change, that their blood pressure was lower and it stayed lower, and their heart rate was a little bit lower and it stayed lower. So we know that when we consistently give our body a chance to do this, it tends to slow our brain down a little bit and it tends to slow the body down a little bit. And I've added it to this training just to give us a chance sometimes when we are going very fast, when we feel unsafe and out of control. If we have been practicing this, and again, the more you practice it, the better it works, you can take a breath, say your phrase to yourself, do that once or twice. Nobody even knows you're doing it. That might give you just a tiny little bit of breathing room in your head to go back and go through these calmer skills, checking in, accepting whatever's going on with you, trying to be lovingly kind to yourself, being mindful about what's actually happening and what's not, expressing what needs to be expressed and responding in a way that fits the situation maybe a little better. So in our last moments, I'm gonna pause to look at our Q&A section. We have a question from Michael. Does the brain or body being exhausted or tired have anything to do with a trauma to happen? In other words, I think what you're asking is, does that make us more vulnerable to trauma? I would say, yeah, probably. Simply because it is even harder to get the brain and body back online when we're fatigued. I think that's your question. So yeah, I would say that it does. And if you want to talk more about that, as I said, we'll be doing more trainings and please reach out to us. But that's a great question. I've never had anyone ask me that. So yeah, I think it certainly can leave us more vulnerable to feeling overwhelmed, which takes something from being stressful to being potentially traumatizing. Okay, and I think that's all that I've got for comments. So I'm now just going to finish up with you guys. As I said, there's always more that I would want to talk to you about than we have time to go through. But I want to leave you with this. I'm a trauma therapist. I believe in trauma therapy. I believe in adjunct therapy like music therapy and art therapy and occupational therapy. And I believe in medication when it's prescribed carefully and sensitively. And if it were up to me, I would have all of those resources available to all of the people that we serve, the 90,000 souls that we serve just here in Ohio. And hopefully someday we will. We obviously don't right now, but perhaps we will, and we should all be working towards that. But if you asked me, with all that I know about trauma, if I had to choose between all of those tools and you guys that are in this training today, I would choose you every time. And why? Because when the folks you are dealing with, the people that you support, some of whom have spent decades locked into these brain states, locked into these patterns of being and behaving, and you give them a chance to feel safe, connected, and in control, and you give them a chance to experience that over and over and over, particularly in the context of a caring, supportive, warm relationship with you. You let their brain experience something different. You let their brain experience what their brain is craving. And given enough time and given enough repetition, that's the best chance a brain has to heal. And so if you ask me to choose all of those wonderful tools and techniques, that's why I would choose you. And you might be that person's best chance to live their authentic lives as their real selves, not their lockdown, agitated trauma state, but as their true selves. And I'm profoundly grateful to you that you are willing to do the very hard work to offer people that chance. And I know that a lot of them can't thank you themselves. They can't thank you directly. They can't thank you in person. So I will take that opportunity and thank you for them. Thank you for being willing to do that. And thank you also for your time today. I've really enjoyed spending these last 4 hours with you guys. I know we'll be doing more stuff, and I really appreciate your time on this nice Friday. And with that, I will wrap things up and hand things back over to Kevin, and we will get you guys going.